This is Essentials of Pharmacology for Health Professions, 9th edition. Chapter 7, Responsibilities and Principles of Drug Administration. Please keep in mind that this is not to supplement the additional information in the ebook or the book. Upon completion of this chapter, you should be able to list at least 4 responsibilities of the healthcare provider in safe administration of medications, list the 7 rights of medication administration, explain moral, ethical, and legal responsibilities regarding medication errors, describe 2 instances of medication administration that require documentation, and explain the rights of the healthcare professional to question or refuse to administer medications. Responsible drug administration. The safe and accurate administration of drugs require knowledge, judgment, and skill. There are 4 critical responsibilities a healthcare professional should adhere to when administering any medication. You always want to make sure you have adequate and up-to-date information about all medications to be administered, and that includes their purpose, their potential side effects, contraindications, cautions, and possible interactions. Always be able to demonstrate wisdom and judgment to accurately assess the patient's needs for medications and be able to evaluate the response to medications and plan appropriate interventions as indicated. It's important to possess skill in delivery of the medications accurately and in the best interest of the patient, and also demonstrate adequate documentation. As well, provide patient education to the patient and family about why, how, and when medications are to be administered and their potential side effects and precautions with administration by the layperson. Other responsibilities of a healthcare professional for safe administration of medication include the following. Being familiar with every medication before administration is very important. Use resources if you don't know the medications, such as the PDR, Physician's Desk Reference, the AHFS Drug Information, the USPDI, package inserts, linked electronic sources, or pharmacists need to be consulted before administering any drugs to make sure that you are familiar with its desired effect, potential side effects, cautions and contraindications, and possible interactions with other drugs or with other foods. Knowledge of the typical and most frequently used drugs to treat the body systems. Another responsibility is complete planning for patient care, including prior assessment, interventions, and evaluations of the results of drug therapy. Need to assess the patient and their current drug regimen, including prescription and over-the-counter medications, and assessing the patient's overall health status, including vital signs, posture, skin temperature and color, and facial expressions both before and after drug administration, or other responsibilities for safe administration of medication. The goal of safe administration is to maximize the effectiveness of a drug with the least amount of discomfort to the patient. Patient education is very essential in safe drug administration, and they must understand the importance of taking their medication in the proper dose, time, and way. Verbal and written instructions should be provided, and demonstrate proper administration techniques will provide the patient the information and skills needed to perform self-administration. Ethical drug administration. Administration of medicine carries moral, ethical, and legal responsibilities. Always consider the following when administering medications. When in doubt, always consult with those in authority. Refer to policy and procedure handbook when needed. Provide patient education when needed. And always document in the patient's chart for all medications administered. And always remember to record controlled substances in the narcotics record in addition to the patient's medical chart. Medication errors. Medication errors can occur in any healthcare setting. Acute care settings report more errors where the risk is greatest. Ambulatory care sites, home health care, outpatient facilities, and long-term care facilities also have challenges unique to their practice. It's very important to know that when the number of medications for an individual increases, the risk of interactions and adverse side effects and the risk of error also increase. Let's consider the following medication errors and how they can occur. Administering a drug to the wrong patient, administering the wrong drug or drug form, administering a drug via the wrong route, administering a drug using the wrong technique, administering a drug at the wrong time, administering the wrong dosage, and wrong documentation. Improperly documenting drug administration information on a patient's medical record. Medication reconciliation is a method used to compare the medications a patient is currently taking to the medications ordered by the patient's physician. Medication reconciliation is done to prevent medication errors caused by omissions, duplications, errors in doses, or medication interactions, and it should be done every time the care plan changes. There are 5 steps, according to the Joint Commission, to look at for medication reconciliation. First, develop a list of current medications. Second, develop a list of medications to be prescribed. Third, compare the medications on the 2 lists. Fourth, make clinical decisions based on the comparison. And fifth, communicate new lists to appropriate caregivers and the patient. Principles of administration. When preparing to administer medication, there are several basic principles that should always be kept in mind. First, cleanliness. You want to always wash hands before you handle any kind of medications. Make sure your area is clean and neat. And wear any required personal protective equipment or PPE. Organization. Always make sure you have the right medications and supplies and in the appropriate area, and you have an adequate supply. You would need to reorder any stock drugs that are used immediately. Your preparation area should be well lit and away from any distractions. There are guidelines to review before administering medications, and these include the 7 rights of medication administration. The right medication. You want to carefully compare the name of the drug that's prescribed on the physician order with the label on the package, bottle, or unit. You never give medications when the name of the medication is obscured in any way. The right amount. Drug dosage ordered must be compared carefully with the dose listed on the label of the package, bottle, or unit dose package. Right time. Drugs must be given at a prescribed schedule. The physician will order specify the number of times per day and the medicine that is to be administered. The right route. Route is very important because it will affect the degree of absorption, speed of the drug action, and side effects. The right patient, of course. We need to have the right patient who is to receive the medication, and they must be identified by their name and date of birth to reduce the chance of error. Right documentation. Remember, if it is not documented, it has not been done. Every medication that's given must be recorded in the patient's record along with the dose, the time, route, and location of the injection or how medication was taken. And the right technique. Each route and each medication may have specific rules that apply regarding the technique for administering. The person administering the medication must be knowledgeable on the various techniques. There's further information in your book regarding these 7 rights. This is figure 7.1 from your book, 7 Rights of Medication Administration. Medication administration and documentation. Every medication given must be recorded in the patient's chart. It is very important to provide detailed information that includes dose, time, route, and location of injection. In addition, it's important for healthcare professionals to document any adverse reactions to medications. Accuracy is crucial, and the individual administering the medication must be the one to complete the documentation. Narcotics also need to be documented accordingly. This should be documented on the Special Controlled Substance Record. If narcotics are needed to be destroyed due to partial dosage, cancellation, or error, 2 healthcare professionals are required to sign as witnesses to the disposal of the drug. Medication administration refusal rights for healthcare professional. Safe and effective administration of medication involves current drug information, technical and evaluation skills, moral, ethical, and legal responsibilities. The 7 rights of medication administration are guidelines for healthcare providers to utilize, and they have the right to question any medication order that may be confusing, out of the ordinary, illegible, and inappropriate. In addition, you also have the right to refuse to administer based on those findings and if they feel it is not in the best interest of the patient due to any discrepancy. The safety of the patient is the first priority. MedWatch reporting. MedWatch is an FDA safety information and adverse event reporting program that was started in 1993. This provides a platform for healthcare professionals to voluntarily report any adverse reaction that may occur from the use of a particular medication. When reporting, the information to include is the patient demographics, information about the medication including name, dose, how it was administered, and recording any adverse reaction. See Figure 7.2 for a sample MedWatch form that's in your book. MedWatch assists the FDA to monitor safety of products and, if needed, to take immediate action to protect the public from medications that do not demonstrate positive benefits. In response to the reports, the FDA has issued warnings, revised labels, required manufacturers to do post-marketing studies, and ordered several products to be withdrawn from the market. Now let's check your knowledge to see what you learned from this chapter. There are 5 questions. Pause the video, write down your answers, and then you can check your answers with the answers provided. One more slide after this one. Keep up the good work. This is your last question. The answers will be provided after this slide. Answer the following questions to assess yourself for further learning in this chapter. This concludes our lesson for Chapter 7, Responsibilities and Principles of Drug Administration. Thank you.